Hi, today we're gonna talk about tooth decay and how it progresses when bacteria attack your teeth. Well, first of all, bacteria aren't bright creatures and they don't have a plan of attack. They just stick to our teeth, eat sugar and crap acid. And the longer they stay there, the more damage they cause. The first thing you can notice is a white spot on the surface of the tooth. This means that the minerals in your enamel got damaged and there are microscopic holes in it. Usually nothing hurts at this point, and this condition is reversible by upgrading your cleaning game and using fluoridation or hydroxyapatite. That white spot will probably stay there, but the damaged enamel may harden once again. In the next stage of tooth decay, bacteria get through those micro holes under the enamel and start eating away at your dentin. The discoloration on your tooth turns brown, and a hole filled with bacteria and dead soft dentin forms. It might be hard to spot a small caries, especially if it occurs between two teeth, and that's the most probable place because most of you don't floss. And even though a small lesion usually doesn't hurt, a dentist's intervention is needed to fix it, drilling out the damaged tissue and filling the cavity. If a patient comes to me with a small hole in their tooth, I know straight away that the hole is really big, because the enamel, not being supported by healthy dentin, cracked open and a physical crater formed. If the bacteria didn't get to the pulp, but instead just went on an eating frenzy under the enamel's surface, we can still save the tooth with a filling, or in more severe damage, with a crown. The next stage is pain. When those icky microbes get to the pulp, it's unbearable. Well, usually. And usually no drugs can help you now. This is the moment when most people stop thinking that everything is fine and get their ass to the dentists, only to find out that they need a root canal treatment or pull the tooth. That will also get rid of the pain source, but the consequences are later greater both to our health and our wallet. If you're one of those unlucky few that didn't get tooth pain now, or you skipped on your next appointment during a root canal and never looked back because the pain stopped, or that treatment failed, yes, that might also happen, you're in for the next stage of tooth decay, which doesn't have much to do with teeth anymore. The bone at the apex of an infected root starts receding, and a soft barrier tissue is placed by our body in its place, which gets also infected and the lesion grows. This process may be going on for a long time without giving any symptoms, until it does. The hole in the bone gets filled with pus and suddenly, without warning, there's a throbbing pain. That's why it's important to do x-rays every 2 or so years. The treatment depends on how much damage there is to your bone and may range from repeat root canal through microsurgery to tooth extraction. Because if we won't find this lesion in time or it doesn't start hurting on its own, the next stage is even more grim. The bacteria will go through the bone and under your gums. In the more optimistic version, a little whitish yellowish ball will appear on your gums and it will pop and you will feel the taste of pus in your mouth. And this will keep on repeating. It's a sign to go to your dentist ASAP. In the less optimistic version, an abscess will form under your gums and your face will swell as if you got sucker punched in a bar brawl. It will have to be cut open to let the pus out, and anesthetics might not work very well, but this still is the better option than a septic shock and going to the hospital. Well, I hope you learned something useful. Thanks for watching, and I hope to see you on regular checkups instead of once in a few years with a scalpel in my hand. Have a good day and see you next time.